Well, thanks, Carol, and thanks to everybody who participated today. This was really a terrific bunch of content. Actually, one of the more interesting sets of folks I've had a chance to observe. But what I wanted to do actually with our moderators pulled back together, want to just get a sense of what people kind of took away from each of these areas. So first, the first panel was focused on usability and on quality of data and how that works. I think I heard that people need to be conscious of updates. Beware the updates. That was one of the things I took away. That just because something has been installed and implemented doesn't mean that it isn't going to be updated and break something. So that was an interesting piece of learning I had. But I'm interested in what you all thought about that panel one.
Sure, I can jump in. So for me, I think I'm really interested in continuing to watch what the Sequoia project does with the data usability piece and that community initiative. And so what I heard was get involved and share your perspective. And that really was a key theme throughout today. But I think Didi highlighted how this particular initiative is looking at what can all people participate in and contribute to now, and then future iterations of that as well. So really kind of taking interoperability a step further, just looking at data quality and usability in terms of let's continue the standardization. Let's continue thinking about what processes we're involved in and making sure that we're all on the same page and convene these conversations around these topics.
Any of the other you have any thoughts about panel one?
Yeah, I'll be glad to go ahead. Thank you, Scott. The whole issue of data quality is something that I've certainly thought a lot about in the last few years. The idea that with interoperability, a provider may be seeing a patient, they open up the records, some new data from another source has come in. Depending on where those sources are, sometimes there's duplication, there's confusion around that. So just the quality of how that data is presented, but also that usability. I think this cultural shift that needs to take place, hopefully it's starting to take place, is whether that data can be trusted. A lot of providers don't automatically trust data that they receive unless they've put their eyes and directly on the patient and what their diagnosis, things like that. So that goes to trust, and usability is going to require trust.
Yeah. Well, let's go to the next panel real quick. The digital identity panel focused on kind of digital identity and patient matching. Very much interested in some thoughts about this from you, Kyle. But the big, of course, the straightforward summary is that without digital identity, FHIR is not going to scale. Okay, I took that away. But what else did you feel like you learned?
Well, I'll tell you what. I'm going to back up just a little bit. I will answer your question, but just to answer a little bit about your previous question about the last panel and how it relates to the identity panel. I mean, what I got out of this whole summit really was identity. I have my head stuck in identity all the time. It's what I live and breathe. It's what I focus on. And what I learned is, it is one relatively small dimension of a very multi-dimensional problem. And the first panel did a great job of sort of characterizing that. One thing that stuck with me was Catherine Lusk's example of her CCDA, and she was trying to get information from the provider, but she wasn't getting what she wanted. And just through basically research and figuring it out, she was able to get what she was after. And honestly, that problem doesn't have anything to do with identity. It's entirely separate. And so I found that really fascinating. In fact, all the panel sessions were very fascinating. But with respect to identity, there were a couple of themes that I thought really came out. And they're themes that are often vocalized in the identity space. Friction being a big one. When you're trying to look at an identity provider, it's a big deal. You don't want to encumber your patients. I mean, to these institutions, a patient is someone to treat, but it's also a customer. you don't want to drive them away. It needs to be a frictionless process, and that's a very important takeaway. But sort of part and parcel of that is federation and connectivity. It's related to friction, because if you don't have federation and connectivity, then they're going to have to do that multiple times. Ergo, friction, more friction, right? Mm-hmm. So I think those were some of the biggest themes here, in addition to consensus, also related to federation in that way.
Any other thoughts about identity from others? Susan, what are your thoughts? Any thoughts?
I heard one of my favorite concepts of something exists, it's just not adopted. So I mean, it doesn't matter. It's a recurring theme, but in this case, I actually noted Ryan Howells talking about OpenID Connect, that the HR vendors just need to accept and adopt. So that was a thing for me of, I hadn't really, because I don't live and breathe an identity world like Kyle does, that it was, oh, this is the same problem. This exists. We have to figure out the awareness, the adoption, the motivation. So that was my takeaway.
I think that's an overarching theme of the day for sure. Yeah. Because if you've got it, use it, and find out if you have it, and then use it. So I think that was a big thing. Well, let's skip to number 3. So this actually was very interesting. I think this is your panel, right, Susan? Is this your panel? Oh, I'm sorry.
No, it was Grace. Or Catherine.
Oh, yeah. It's great.
Susan could have done it too, but
go ahead, Catherine, with this one for great pinch hitting for Grace, Catherine Wickenhauser.
Well, and so we want to talk about Grace, and the patient piece. I think for me, there's so much opportunity. So there were so many wonderful nuggets of wisdom in what each of those women had to share, and the different perspectives that they have, how they're approaching the patient, consumer, care partner involvement, engagement, and interoperability. And I think of all of the panels today, that's probably the one that I need to go back and listen to completely over again for everything to really resonate, because it was just jam-packed full of wonderful ideas and next steps. And I really hope that it was actionable and inspiring for attendees today to think about how they further incorporate engagement for patients into their own organizations, platforms, solutions, et cetera, because I think this has been a gap. Interoperability is really about patients, but so often we're on the clinician side, we're in the other side of things, as the panel that I moderated talked a lot about. It wasn't really use cases for patients, but thinking about how many opportunities there are. One of the things that resonated with me on that panel was, what does the framework for engaging patients look like? I'm really excited to hear that conversation continued, because it seems like something that should exist, and maybe it does exist, and I'm not aware of it. But really looking forward to hearing more about that from those dynamic women.
Totally agree. And we did skip over your panel, Catherine. It was actually your panel that was next. But that is sort of what I heard in the panel. It was talking about use cases. So like, what are the use cases that are of interest right now? Like, what do we see? I actually learned of some really interesting use cases. I found this hospital at home use case for smartphone deployed diagnostic and therapeutic devices. This is really, really interesting and just getting started. So that is a very interesting use case. That said, the other thing I think we once again said is, if it's lying around, can we use it? I mean, I think that was like one of the things that we learned that was a key takeaway from the entire day. Let's do the value step before we decide to do something new. Let's do something that works already. So what did you take away, Catherine?
Very similar. That concentric circle idea of we started at one spot, and we think back to, meaningful use and how that got started. And I know Jim knows this world really well and how we've expanded. I laugh, and sometimes I'm embarrassed to share this story, but I used to refer to interoperability as a unicorn because everybody was talking about it, but no one had seen it. And that was the mindset. Like when we think about what Mo said in the last panel of EHRs did not speak the same language, we've come really far in a short amount of time. Now, don't get me wrong, there is a lot of work to be done, but sometimes I don't think we stop and reflect on how much we've done in a short amount of time, and thinking back to that meaningful use mindset and really trying to get everybody on the same page and trying to move forward. A lot's happened. And obviously, now I'm a big believer in interop. I've got my team interop shirt on. So interoperability is no longer a unicorn. Interoperability is a real important, making a difference thing. But Jim, from your perspective too, does this resonate with you with this meaningful use to today continuum?
It certainly does. I'm going to tell an anecdote here. The steps of interoperability. You may laugh at this, but the biggest jump I have, if interoperability is defined as the right information on the right patient at the right time, the biggest step forward I have seen in decades was when fax machines first came in. Now, fax machines, there's not discrete data, it's not codified data, it's not actionable. It's actionable if somebody reads it. But I worked for years in large specialty practices, and one of the big problems was patients would show up and say, "Somebody sent me here. I don't know why I'm here." And so the fact that you could call somebody on the phone and they could fax something to you, and you could take care of a patient. So it's funny, but to me, those fax machines, I don't know if that was the early 80s when we got the fax machines and everybody immediately bought one. Even though that was not discrete, it was a big jump in interoperability. And so, it's funny, Susan's just put in the chat the old silky curly fax paper. Yeah, we were glad to see that silky, because we had something we could hand the doctor that they could take care of the patient with. So I think you're right, Catherine. It's incremental. Every now and then there's a giant step forward. So yeah, I agree with that, certainly.
And I've got something to add there too. Interestingly, that the premise of you have a standard, use it, or what's available, can we piece these together that already exist, that may have mild adoption in certain cases? Can we use that? Can we make that work? Outside of where you intended for it to be, Catherine, with respect to healthcare interoperability, this has a direct relationship to identity too. Same exact kinds of problems. There's no shortage of different types of identity credentials and federation mechanisms and ways of communicating identity to somebody else. That is not the problem. There's lots of that out there. It's choosing one that has relative adoption out there to try to get everybody to kind of get on the same sheet of music. That's the hard part. It's not that it doesn't exist. A lot of times folks will look at a problem and say, I don't actually know there's a standard out there. Then they go make a new one. And really the better thing to do is to put your energy toward trying to see if there is something out there that already has solved this problem, because most likely it probably exists. It's probably out there. And so that really resonates with me too.
Yeah, I think that's absolutely true. And I think the other thing is, if it's already out there, it's a lot less expensive, right? Because you don't have to build it from scratch. The other thing is that interoperability that exists in small pockets isn't actually what we're looking for. We're looking for ubiquitous interoperability, which is to say that wherever the patient goes, that their data can flow with them. That is a very different story. And also enabling new capabilities that so let's make the transition to the last discussion, because I think first of all, we ended where we began, which is, even though I think people were like, I thought this was about interoperability. What's this AI stuff? So the point is that this AI stuff came up in almost every one of the panels, because this AI stuff is going to impact us, and we don't even know how. But I think what we heard is some real concrete examples from somebody who's on the front line of that. So you hear Mo talk about what they're doing at NextGen with AI. Like that's, like it or not, I mean, there's going to be some people who are freaked out about this. Like it or not, it's coming. So don't. So the best thing to do is the actionable thing I would take out of that is learn about it because you're going to need to understand how it's going to impact you. If you don't learn everything you can about it, I bought the book that Mo talked about. I bought it while he was talking. So in any case, that's what I felt like I learned from that last panel, which I think is the kernel of the day is where is this really going? And what did you all take away from that? Let me start with, so actually, I think Jim started with, but let's start with Kyle because he's got his hand up. So
Okay.
Yeah, and I'll be quick. A lot of the stuff was over my head, but one thing that really made a whole lot of sense to me, and I hadn't really contemplated this problem before. Like I experienced that a lot today, actually. Lisa made a point about a provider gets information, and it's made a series of hops to get there, and you don't know where it's been, you don't know where it originated, and most importantly, you don't know if it's right. You don't know if it's correct. Is it correct or not? I don't know. There's not an easy button for that, And I really hadn't thought about that. And this is why everyone talks about data provenance and where is this coming from? Can I actually trust and rely on this? And really that was a big takeaway for me, where I'm not suggesting I even have a solution to that problem, but it certainly is a problem that I think is worthy of a lot of attention.
Well, her suggestion was actually patient as correctionist.
Right.
Okay, so,
exactly.
Which is actually, not a bad idea. But the problem is the digital front door of the HR is closed, right? So those kinds of innovative capabilities that you might want to enable, the EHR doesn't actually enable that with Fire. The Fire Tech supports it. The Fire Spec supports it, but the actual EHR transactions aren't there. The digital door is closed. So, Jim, we totally jumped the line on you.
No, that's okay. And before we totally run out of time, I want to tell you about an experience I had this morning. This really has to do, we're talking about interoperability, but part of that, the patient access to the record, to be able to correct the record or input data or whatever that is. And so I was at an internal medicine practice this morning, sitting in the waiting room, and they have a kiosk for check-in. And I've sat there for about 30 minutes watching people trying to use those kiosks. And it's probably a state-of-the-art of a kiosk, but it's much more complicated because of regulations and whatever than a kiosk at an airlines. Mm-hmm. And so if it's difficult for patients to use a kiosk, they're older patients, they're sicker patients, how are they going to be able to interact with their health record? That's an ongoing concern I have.
One panel we did not have, and that we might want to consider for a next discussion, is usability. So usability is like workflow usability. Like we did have this sort of notion of data that is high quality but that we didn't talk about usability so much, like in the application. This is actually I actually have this concern about what is going on. The usability that they're talking about in the Sequoia effort is mostly about data. And the workflow is actually where usability most manifests. So my guess is a kiosk could be produced that makes good sense to the patient, but they would have to do those bundles of things that Grace Cordovano was talking about all at once, instead of an impossible, really voting machine from hell kind of experience that I think a lot of these kiosks are. But I think kind of closing out, I think we probably want to do sort of, Catherine, you want to I do feel like there are threads that pull through the whole discussion today. So do you want to help us with that a little bit?
Before we go there, I just want to take a minute. Susan, did you have something else to add to that question before? Because I don't want to.
Well, I got pretty excited about some of the stuff Mo and Justin said, just real quick on AI, back on the AI. because something else I heard, maybe it's in your themes, is the fire hose of data and which pieces are relevant to what I need as a user. So I hadn't really thought about that. That's a place for AI to solve, because this has been, now that we can get data, like which parts do we want? So that one, and the voice things resonated with me, because I have just recently heard, I mean, this is in action now, the ambient voice recognition for transcription and other uses. So like, what can that do? That was one of my moments. And then, and because I come out of HIE and state government work, I got to applaud, Justin, for the health data utility, which also kind of goes to the work Catherine Lusk is doing on, you have to do collaborative work. There's collaborations, there's governance, there's, contractual arrangement, like whose role is what, to make many parts come together. So just kind of touch on that. So there, I got all my pieces in.
No, thank you, Catherine. I did not mean to leave Susan out. And one more thing I want to say about what you were talking about is that Catherine Lusk, it represents so the actual activity there, to your point, Kyle, is, not interoperability. It's just tenacity. The woman is so tenacious. She just does not give up. And so that's why that worked. It's not like, oh, there's an easy button. Not an easy button. That was a hard road she shared. That was a lot of work. You can tell, right? So that's what I think, what I learned from that is we need people like Catherine Lusk to do the Catherine Lusk trick, because that is actually what it is, a lot of work. It's not a trick. It's just nose to the grindstone work for months. Like, that's what it takes. Mm-hmm. Go ahead, Catherine. I think we're ready to wrap.
Yeah. To me, there was so much great content today. I think there's so many pearls of wisdom throughout today. So I'm excited. All of these sessions are recorded. They'll be available on YouTube. For the attendees, I would encourage you to share these with your colleagues that you think would also benefit from seeing these conversations today. So this event was free because of our sponsors. So just a special shout out before diving into the themes today, thanking our sponsors, MetaQuant, NextGen, ID.me, Secure Exchange Solutions. Because of them, we were able to offer this for free today. So a lot of information in a half-day event. But the things for me that I heard are not necessarily interop specific themes, but broader themes. And so the things that I wrote down in my notebook throughout the day, what I'm hearing, a lot of optimism. I'm hearing optimism and excitement about the future, the importance of collaboration. You heard from multiple panelists today how they're collaborating, not only with their peers, but others in this space as well, or even people adjacent to this space. So collaboration is huge. Involvement. When I'm thinking about what you were just describing with Catherine Lusk and others today, they underscored the importance of being active participants, not just showing up, but actually doing the work, being the boots on the ground, providing perspective. So if you're here and you are wondering how you can make a difference, you heard Mo earlier highlight the many different interoperability initiatives. There's room for you as a volunteer to share your perspective. So involvement is key. There's more work to be done. I think we all know that. We all heard that today, that we are not at the end of the rainbow, as Jim said. We've got more work to do for sure. And then the other key theme that I heard that went throughout every panel is the importance of trust. And what that means in so many different capacities. Trust is definitely a multifaceted thing, but to make interoperability work and for the future of interoperability and health tech in general and digital health, we have to get trust right. And trust will look different in multiple situations, capacities, et cetera. But so overall, my 5 key themes I heard: optimism, collaboration, involvement, more work to be done, and trust. And I think that summarizes where we were at today. So with that, I guess, Carol, we can wrap it up and we can turn it back over to you. Thank you all so much for attending today.
Thank you.
No. Yeah, thank
Good
you.
event. Thank you all.
attendees, panelists, you actually, everybody, you all made my job the last 4.5 hours very easy. So thank you very much. For attendees still with us, we will get these recordings out and up on YouTube, and also the link sent to you in an email. So thank you to everybody for your time today. A great event. So
Great. Thank you all.